nyo at yun naman pong na-test na at nakita na natin na positibo sila, ngunit mild and asymptomatic, maaari naman sa ating quarantine facilities. Sir Vince, ito po bang mga isolation facilities, kailangan po ba ng requirements dyan? Ano po ba ang dapat isaalang-alang ng ating mga kababayan bago sila makadiretso dito sa isolation facilities natin? Sir Vince?
Yusek Rosette, I'm sorry, medyo nawala po kayo, sorry.
Yes, sir. Sir, tanong po lang natin kung ano po ba yung mga may requirements po ba ang ating mga kababayan para sila ay ma-admit dito sa isolation facilities natin?
Unang-una po, no, para maintindihan po ng ating mga kababayan, unang-una po, hindi po pwedeng mag-walk-in sa mga facilities na ito, no? Para po maintindihan natin lahat, no? Hindi po pwedeng mag-walk-in. Kailangan po ay ang mga pasyente na i-admit dito ay dadaan sa mga city health officer at sa mga or sa mga ospital, no? Kasi po kailangan ay ma-examine muna sila. Unang-una, kailangan ma-test muna sila kung sila positive. Ikalawa, kailangan ma-examine na muna sila dahil po ang tatanggapin lang po dito sa mga facilities na ito ay yung mga mild or asymptomatic. Ang ibig sabihin po nun, yung mga wala masyadong nararamdamang sakit at wala masyadong sintomas. Dahil po yung mga may sintomas at medyo mas paggrabe ang sintomas, kailangan po yan ay talaga sa hospital po inaalagaan.
Okay, sir. Ito naman po ay isang isolation to quarantine facility. Sir, tinatanong po ng maraming kababayan natin, ano po ba daw ang parang buhay nila sa loob kapag naka-admit na sila? Paano po ba ang sistema po? Paano ang pangangalaga? Paano ang kanilang pang-araw-araw na buhay dito sa quarantine facilities natin?
Yusek Rosette, sorry po, paulit po ulit. Pasensya na po
Yes, sir.
Nawawala po.
Yes, sir. Tinatanong lang ho ng ating mga kababayan kung ano daw po ang ating sistema kapag sila po ay na-admit na sa mga isolation and quarantine facilities. Ano po ba daw ang parang buhay nila sa loob ng mga facilities for 14
po, no,
days?
Nakakatuwa po, Ma'am Rosette, dahil talagang ano po ng maigi ang mga facilities na ito sa tulong ng pribadong sektor na talagang napakalaki ng tinulong dito. Kaya po dahil doon, unang-una po, air condition po lahat ng mga isolation and quarantine facilities natin. May libre pong pagkain at may libre pa pong wifi. At ang pinaka-importante po ay meron pong mag-aalaga sa kanila. Alam ko po, mahirap po ito dahil mahihiwalay po ang ating mga kababayan sa kanilang mga mahal sa buhay. Pero ang maganda naman po ay maaalagaan po sila ng mabuti sa mga quarantine facilities na ito. At konting tiis lang po. At kapag sila po ay negatibo na sa COVID-19, pwede na po silang umuwi at makasama na po ulit ang kanilang mahal sa buhay.
Ayan, no? Ginagawa talaga ng ating pamahalaan na maging komportable ang ating mga kababayan na malalagak dito sa isolation facilities natin. So, Sir Vince, dahil nga po may mga aircon, may mga wifi at bibigyan sila ng pagkain, aalagaan sila ng doktor, meron po ba daw bayad dito sa ating mga isolation facilities?
Kaya po, Yusek Rosette, libre po lahat ang ating isolation at quarantine facilities.
Yan, no? Napakaganda at napaka-importante po para hindi nangangamba ang ating mga kababayan kapag sila ay may nararamdaman na magpatingin at kung sakasakali ay makapag-admit, no? Mai-admit dito sa ating isolation facilities, wala pong babayaran kahit 5. Sagot ng pamahalaan, through PhilHealth po ang ating community isolation facilities. Sir Vince, dito po sa 7 mega community quarantine facilities natin na meron tayo ngayon, meron na po ba tayong datos? Meron po ba tayong plano na dagdagan pa ho itong mga mega facilities natin? At ano po ba
Opo, ma'am.
Yes, sir. Sige po. No. Go ahead, Sir Vince.
Opo, ma'am. Dadagdagan po natin to dahil nga po, kung ka-translate lang natin sa English, it is better to have these facilities and not need them than to need them and not have them. Ibig sabihin po, mabuti na pong handa tayo para kung dumami po ang mga magkakasakit sa COVID-19, meron po tayong lugar kung saan pwede natin silang alagaan. At ang importante din po siguro na maintindihan ng ating mga kababayan, ang mga facilities na to ay napaka-importante para po yung ating mga ospital po ay hindi masyadong mabigatan sa pagdagsa ng mga pasyente kung dumami po ang mga magpa-positive o may infect ng COVID-19. Para po yung ating mga ospital ay marereserba lang po para sa mga medyo talagang grabe ang kalagayan at talagang kailangan ng alaga sa ospital. Kaya gagawa pa po tayo, no? And in fact, ngayon po, tuloy-tuloy po ang paggawa ng ating DPWH.
Sir, meron na po ba tayong current capacity nito at ano po ba ang datos natin ngayon dito sa ating mga facilities na ito? Sir Vince? Sir Vince? So ayan po, no, nagpuputol-putol po ang ating linya para dito. Mamaya po natin siguro ipagpapatuloy ang pakikipag-usap kay Sir Vince Dizon, ang ating Deputy Chief Implementer ng National Task Force. As of 4 p.m. today, May 13, nakapagtala po tayo ng 268 na bagong kaso at umabot na po ang ating kabuang bilang sa 11,618. Sa bilang ng mga bagong kaso, 165 o 61% ay mula sa National Capital Region at 58 or 22% ay galing naman sa Region 7. Meron din po tayong 145 na bagong bilang ng mga kababayan na nakarecover mula sa COVID-19. Sa kabuuan, meron na po tayong total na 2,251 recoveries. Kasama po sa mga naitalang nakarecover ay ang mga pasyenteng nakakonfine at mga pasyenteng may mga positive, mild at asymptomatic cases na nakarecover na mula sa kanilang self-isolation at home quarantine. Ngunit ikinalulungkot po naming ibalita na 21 ang nadagdag sa bilang ng ating mga kababayan na pumanaw dahil sa COVID-19. Umabot na po sa 772 ang bilang ng mga nasawi. Ipinapaabot po namin ang aming taus-pusong pakikiramay sa lahat ng mga naulila. As of May 12, makikita po sa inyong screen na meron na po tayong 2,125 healthcare workers na nagkaroon ng COVID-19 sa ating bansa. Sa bilang na ito, nakapagtala po tayo ng 669 na healthcare workers na nag-recover mula sa COVID-19. Nitong mga nakaarang araw ay paunti na ng paunti ang nakikita nating healthcare workers na nagpo-positibo. Sa nasabing bilang, ang 1,421 ay active cases. Ikinalulugod po naming ibalita na kahapon ay wala po tayong naitala na kapamilyang healthcare worker na namatay mula sa sakit na COVID-19. Ang kabuuang bilang po ng deaths among healthcare workers ay nananatili sa 35. Nakikiramay po kami sa mga pamilya at kasamahan ng mga yumaong bayani natin. Kami naman ay nalulugod din na ibahagi ang susunod na graph na nagpapakita na patuloy ng pagbaba ng mga bagong kaso ng COVID-19 sa ating mga healthcare workers mula April 11. Makikita po dito ang pagbaba ng mga kaso ayon sa propesyon ng ating healthcare workers base sa onset of illness. Malaking tulong ang ating infection prevention and control measures na striktong pinapatupad ng ating mga ospital upang masiguro ang kaligtasan ng ating mga frontliners. Tungkol naman po sa kapasidad ng ating health system. Makikita niyo po sa inyong screen ang number of beds in hospitals. As of May 12, meron po tayong 13,553 total bed capacity na dedicated po sa COVID cases lamang. Makikita din po kung ilan sa mga beds na ito ang ward, isolation at ICU beds. We will release today our daily situational report showing the latest numbers as well as all initiatives and activities of DOH in this war against COVID-19. Para naman po sa iba't ibang kagamitan at personal protective equipment na ating patuloy na ipinapamigay sa mga ospital at pasilidad sa ating bansa, makikita po sa inyong screens ang kabuuang bilang at breakdown ng mga naipamigay natin kahapon. Sa atin pong huling pagtatala kahapon, May 12, ang kagawaran ay nakatanggap ng 88 na facility request para sa emergency hiring ng healthcare workers. Meron na po tayong 4,003 slots ang na-approve for hiring sa 74 na hospitals at quarantine facilities. Philippine Arena COVID-19 Facility and QI Quarantine Facility. Meron po tayong 1,237 na personnel ang natanggap sa 19 na ospital at quarantine facilities. Nakapag-redeploy din tayo ng 747 na nurses sa ilalim po ng Nurses Deployment Program. 162 sa Luzon at 585 sa Visayas at Mindanao sa mga DOH at LGU hospitals na may COVID cases. Patuloy po ang ating panawagan para sa ating mga frontliners. Heto po ang mga numero para sa ating priority facilities na bukas para sa ating mga bagong bayaning healthcare workers. Sa ating testing capacity naman po, kahapon, May 12, nakapagsagawa po ang ating mga laboratorio ng 6,594 tests at sa kabuuan nakapagsagawa na ng 188,649 tests. Ang mga test na ito ay isinagawa sa 172,174 unique individuals kung saan 155,771 o 90% ay negative, samantalang 15,773 or 9% ay positibo. Lilinawin lang po namin na ang bilang ng mga total tested individuals ay maaring mas mataas sa official number na inilalabas sapagkat ang mga numero pong ito ay sumasailalim pa sa case verification and validation process ng DOH. Meron na po tayong 28 licensed laboratories sa buong bansa na nakakagawa ng RT-PCR test. Atin pong inaantabayanan na makatulong sa ating testing capacity ang 73 pa na laboratorio na nasa stage 3. Ang buong listahan ay makikita sa ating BIT COVID-19 Situation Report na ilalabas pagkatapos ng programang ito sa ating website, FB page at Viber community. Nagpapasalamat po kami ulit sa UP COVID-19 Pandemic Response Team sa pagpapaalam sa amin ng kanilang komento na nakapaloob sa kanilang Policy Note No. 6 noong May 8, 2020. The DOH has already taken note of the data errors found in the April 24 and 25 data drops. These issues have been resolved as early as April 26, as well as other inconsistencies communicated by private citizens through COVID tracker at doh.gov.ph. We assure the public that the issues raised are a nominal percentage of the whole data set and does not prejudice the overall interpretation of the data and decision making. Data is continuously rectified the moment we identify any issue, including but not limited to data formatting inconsistencies, case classifications, and proper identification of residents. To shed light on DOH concerns, we will be joined by our partners in Thinking Machines Data Science Incorporation today. Thinking Machines, the leading data science company in the country, is working closely with DOH and the Department of Science and Technology in delivering quality insights to government agencies and the public to best respond to the pandemic through our COVID-19 tracker and the data drop site. Our guest today is Stephanie See, the founder and the Chief Executive Officer of Thinking Machines. Ms. See is a graduate of Stanford University and has worked with Google, where she built analytics platforms on some of the largest data sets in the world. Siya po ay kinilala ng Forbes Asia 30 Under 30 for Enterprise Technology, Towns Philippines, and Asia 21 Young Leaders. hindi na po tayo magpapaligoy-ligoy pa. Ms. C, can you kindly explain to us how we collate and present the COVID-19 data we provide to the public?
Hello.
Yes, Steph. Good afternoon, Steph.
Good afternoon.
Thank you
Good
for
afternoon,
accommodating our request. Yes. Steph, I will go straight to the question. Can you please explain to us how we collate and present the COVID-19 data we provide to the public?
Yes, ma'am. So when we're talking about our health data sets, everything starts at the hospital. Hospital admins every day fill out a case investigation form for every single patient. This data is then input into the Department of Health data systems. Now, the Department of Health will manually go through every case, correcting mistakes as they see them, and calling hospitals to follow up and verify. And sometimes they have to follow up and verify multiple times. Every afternoon, what we do as Thinking Machines is we share the public data sets as is for that day. Now, when the Department of Health identifies and corrects mistakes between 4 p.m. of one day and 4 p.m. on the next day, we update the publicly shared data sets for the next day. We do not update the previous day's data because we believe in transparency and maintaining what is in the public record, as was true of that day. But we do have it in the technical notes that the most reliable data is the data shared for that day. Now, the University of the Philippines team noticed corrections and identified hundreds of changes out of hundreds of thousands of data points between 2 days. These form less than 1% of the data points shared that day. And these were mostly honest mistakes made by frontliners, by health officials, by analysts. I do want to say that there is no such thing as a 100% correct data set in the real world. And in this case, our objective is to provide timely and useful data sets for policymaking. A 99% reliable and consistent data set is a useful data set for the policies and decisions that we have been making. In terms of improvements moving forward, there's a number that are in process. So starting with today's data drop, we have written code to share and which fields, exactly which data points have been corrected between one day and the next day so that public analysts can see and have more transparency into what corrections the Department of Health has made. We are also working with the COVID Kaya group to improve our streamlining of these case investigation files. This is still a very manual process that we are building technology for as we are existing through this pandemic.
Thank you very much, Steph, for explaining the process to our listeners so that they may be able to understand how we get data, what are the different sources of our data, what are the different levels of information and source of data that we get it from, and how much time we have each day to churn out all of this data and put it into our tracker. So, Steph, for today, we received a lot of calls coming from our media partners, and I hope you don't mind that we are going to have you answer some of these questions. Steph?
Of course. Yes, ma'am.
So the first one is coming from Christine Sabilio from ABS-CBN Online. She's asking, is it true na less than 1% lang ang ating errors? Can you give a detailed explanation of the process and where the mistakes are usually made? Steph?
Yes. So to answer her question, there are less than 1%. It is true that less than 1% of the records every day are changing. And we have looked at not just the April 24-25 numbers, but all of the records throughout the last month of data sharing and can confirm that less than 1% of them for any day changed. Starting today onwards, we will be sharing very detailed daily change logs. And I hope that that will also verify the very small levels of inconsistencies in this data set. For the process elements, I hope I have explained how the process is currently still quite manual, but we are working really to digitize this because that will minimize the need to do validation, like constant, nonstop validation on this, and to help us hit our daily reporting targets.
Thank you for that, Steph. Now, from Gerard Naval from Malaya, is the less than 1% error referring only to the errors pointed by UP or all the errors pointed by UP and private citizens?
Yes, so the less than 1% in the data inconsistencies refers to the errors that the UP team has caught, plus all the data points that the that private citizens have caught, and our own analyses of the data sets, which I hope is more inclusive of all of that in total.
So we're saying, Steph, that from the UP side of the findings of UP plus the findings or the observations of our private citizens, this only sums up to just 1% or less than 1% error. Is that right?
Yes, it is less than 1% inconsistencies in the data for any given day in the data set.
Thank you, Steph. From Bons Magsambol, from Rappler, Secretary Duque earlier said that the inconsistencies that the UP team found was less than 1% of the overall data and does not affect the interpretation as a whole. But still, these inconsistencies are accuracy issues. In this time of pandemic, accuracy of data is equally critical. Can the DOH explain why these issues are happening? And moving forward, how can we prevent this problem? Steph?
Yes. In my team's experience, we have built many of these data systems for the private sector. And in every one of those cases, it really takes months to build and test a data system properly. Here with the Department of Health, we've been building it in real time. Like we've been building it and sharing data on it since day one. So the level of difficulty, the level of challenge is really, really high here. What we are doing to continue to improve that reliability of that data set, right now it's maybe 99% reliable and consistent. I would really like it to get to 99.9% reliable and consistent. The ways that we are doing that include one, COVID Kaya. That is something that I'm very hopeful about because taking the manual handwritten case investigation forms, digitizing them, and centralizing them in a Department of Health system is going to go very far in creating reliable dashboards and data sets for all of us to use. Number two, continuing to be very transparent with the Department of Health, our partners here, to share which corrections we are making every single day. We hope we'll build public trust in this data set as they see that the reliability and consistency of this data set improves every single day.
Thank you, Steph. And for our last questions, from Joe Vicky of Philippine Daily Inquirer and Sheila Crisostomov from the Philippine Star, plainly encoding errors lang ba ang discrepancy sa data or from the case investigation form submitted ng hospitals, meron na talagang mali? Steph?
Yes. So it is a mix. It is a mix of factors. This is why there are checkpoints across the frontliners and with the DOH team, with the Thinking Machines data team, and also with public accountability. At every point, all of these stakeholders can check and figure out, is this an encoding issue? Sometimes it's an encoding issue. Sometimes it's a process issue. Sometimes a form was filled out incorrectly or tagged the wrong person. And our goal here is to create a data system that can account for these errors, correct these errors, and have the corrected data sets reflected so that policymakers can make good decisions.
Thank you, Steph. Ang pagkolekta ng live data ay talaga pong very challenging. So we are constantly rectifying any issue the moment we identify it. The issues raised are less than a nominal percent of the whole data set. Ibig pong sabihin, maliit lang po ito kumpara sa kabuuan. Kaya naman it does not prejudice the overall interpretation of data and decision making. Para po mas maging malinaw, hindi po nating sinasabing perpekto ang data ng DOH. Ang sinasabi po namin ay dahil nominal percent lamang po ang tinatawag nilang errors, hindi po ito dahilan para mawalan ng integridad ang ating data at maging hindi kapani-paniwala. Sa kabila po ng lahat ng ito, confident po kami sa kagawaran ng kalusugan na ang ating data ay reliable na basihan ng aming mga nagiging desisyon. Ang ating pong mga data ay kinalap at prinoseso sa tulong ng ating mga expert partners. The DOH remains to be committed to transparency and we welcome feedback from the expert community. Patuloy po nating pagsikapan na makapagbigay pa ng iba pang detalye on the specific rows that we have changed the previous days. Hindi po talaga madali bumuo ng high-quality data system. It normally takes months of effort, hindi lang basta overnight. Ngunit kinakailangan nating i-improve at i-scale up ang ating sistema ng real time upang matugunan natin ang ating pangangailangan habang may pandemya. Kaya't inilulunsad po ng kagawaran ang COVID Kaya, isang bagong digital surveillance system na tutulong sa atin sa pagmamonitor ng kaso ng COVID-19 sa bansa. Ito po ay nabuo sa tulong ng WHO. Gamit po ang sistemang ito, magiging automated ang ilang proseso sa pagkalap ng data, kaya mababawasan ang ating encoding errors. Ms. Steph, maaari niyo po bang ibahagi sa ating mga nanonood at nakikinig kung ano itong COVID Kaya at kung ano ang maitutulong nito sa ating pagproseso at pag-i-interpret ng mga datos? Ms. Steph?
Yes, ma'am. The COVID Kaya
So antayin lang po natin, magbabalik po si Ms. Steph in a little while para po ipaliwanag ang COVID Kaya. Pero tayo po ay nagpapasalamat ng marami kay Steph C. Siya po yung ating Chief Executive Officer ng ating Thinking Machines na ating partner at katuwang dito po sa ating ginagawang kukolekta ng raw data para sa DOH para maibahagi sa ating mga kababayan at para magamit para sa policy making. Steph, are you there? Steph?
Hello?
Yes, Steph, can you now discuss COVID Kaya with our listeners and our viewers? Steph?
Yes. So the COVID Kaya application is a digital application being developed to collect case data where the frontliners can input their data rather than using manual methods, but using technology methods, and to have that data immediately input into the Department of Health systems. So this means that the number of steps it takes to collect data from suspected cases, to verify that data, to load it into a data store, and to have that data usable by all the different scientists, LGU, policymakers, and national policymakers can all be centralized. And I think that will really help everybody make better decisions. So this digital system has been developed by the World Health Organization, and they are working with our Department of Health and DICT organizations to roll it out.
Okay, Steph, are we already implementing COVID Kaya?
Yes, ma'am. I believe that we have we have begun deployment of COVID Kaya, and we hope to have that one central system to follow cases live and having reflected in our data within the next week.
Okay, so that is one great news again for the Department of Health and of course to all of our partners because now we can maybe limit these encoding errors and also shorten the time in collecting our data and give more information to the public as well. So maraming salamat sa iyo, Steph, sa iyong pagpapaunlak, pagpapaliwanag para sa ating mga viewers and our listeners for today. Thank you, Steph.
Thank you, ma'am.
Nagpapasalamat din po kami sa lahat ng ating mga partners mula sa public and private sectors sa kanilang napakalaking tulong at ambag sa ating data validation at analysis. We are collaborating with a wide range of institutions and we welcome other data engineers, data scientists, and specialists willing to contribute to this effort as this is a matter of national importance. The department is grateful to the World Health Organization, epidemiologist of the University of the Philippines Manila College of Public Health, and Thinking Machines Data Science for their immense support in data validation and analysis. The daily data drops would not be possible without their guidance and expertise. Maraming salamat po sa inyo, pati din po kay Secretary Vince Dizon na kasama po namin kanina. Mabuhay po ang mga Pilipino na patuloy na lumalaban sa COVID-19. Sa ilang sandali lamang po ay matutunghayan natin ang video mula sa United Nations Population Fund or UNFPA tungkol sa maternal health. Tandaan, together we can beat COVID-19.
Ito ang aking bahay kasama si nanay. Parang balon, no? Lumulobo.